You're with Julian on the Brown Note, and let's scrap the Medicare surcharge from the Australian tax system. So everyone's finding out that they're getting nothing back this year on tax, and in a cost of living crisis, many had probably used that money in their heads already. And one of the most egregious elements of the tax setup we have in Australia is the Medicare surcharge, which basically is a direct gift from the taxpayer to the private healthcare industry. Never forget the Liberal Party actually tried to kill Medicare. In Australia, Medicare is the public healthcare system. Anything like that, if you're the Tories in the UK, if you're the Liberals in Australia, you want public healthcare to be nixed as much as possible. Now, we have no one other than Johnny Howard, who is Australia's combination of Richard Nixon, Ronald Reagan and Margaret Thatcher all rolled into one cuddly hole, whose economic paradigm shift at the start of the 2000s changed Australian way of life forever and has made, broadly speaking, the idea of home ownership in modern times become a distant memory and not the foundational stone of why you go to work. We are now a nation of renters because the people that were able to buy their own home at 3.5 times the average wage back in the 80s are now millionaires, and everyone else can pay off their investment properties. The tax system is one of the main causes of this, and the Medicare rebate or the Medicare surcharge aspect is basically saying if you don't have private health insurance, you will pay this amount of money. So if you get private health insurance, then you get that money back. Which is like, imagine saying that about car insurance or about anything else, saying you've got to have fully comprehensive car insurance and spend $3,000 a year on it. If you don't, we're going to get you for $3,000 a year on your tax bill. It is a direct transfer of money to the private sector from the taxpayer, and it's a disgrace. This is from when Fairfax Media actually held the government to account, and they weren't being guided by Peter Costello. From 2003, Howard plans to destroy the Medicare system. Under the cover of the fog of war, the Howard government's trying to drive the final nail into Medicare as a universal system. Like Malcolm Fraser in the 1975 campaign, when he promised to retain Medibank and immediately began dismantling it. After the election, John Howard knew that a full frontal attack on Medicare could have cost him the 96 election. Arguably, the single most important factor in John Hewson's loss of the 93 election was his promise to get rid of Medicare. Similar themes in the Liberal Party. It was a crucial factor in Kim Beazley's narrow defeat. Was his failure to promise to restore Medicare. Adequate health cover was and still is a big security issue in the minds of families, as the Tampa Children Overboard affair. Beazley's failure to exploit the health issue leading up to the 2001 election, opened up by Howard's ideological commitment to private health cover, exhibited a failure of political nerve. In the run-up to the 96 election, John Howard was pressed on his commitment to Medicare, which many observers felt was cosmetic. Honest John was finally forced to state he promised to maintain the system in its entirety. Since then, to reverse the continued decline in private health insurance that fell from 50% in 86 to 34% in 96 to just over 30% in 98, Howard introduced the 30% rebate on private health insurance, despite a $2 billion a year cost. The rebate doesn't deliver value for money, either to those who take out private health insurance or the nation's health. But the rebate's not the reason Howard has succeeded in increasing the proportion of population in private health care from 15 points to 45%. The government has coerced people into private health insurance through this Medicare surcharge, which now you basically get. So basically, if you buy private health insurance now, you get all that money back on your tax. If you don't, you pay it. This is a direct gift to a cratering private healthcare industry in Australia. The private healthcare industry is a morally disgusting paradigm. and I'm going to do a big piece on this at some point on private education and private healthcare. The idea that the nurse saving your child's life, her children gets worse healthcare than yours is pretty much morally repugnant. But the idea that you are forced into this brinksmanship with buying private health insurance or not, for a start, it isn't available to a lot of people financially to do so. Secondly, poorer people generally have worse health historically and are stung more by private health insurers. Thirdly, private health insurance continually winds back what it gives you, so that it continually gives you less and less and less, and you're now paying for what you should be getting on the public healthcare system. Now, I worked in a hospital for 14 years in the finance, and we used to bribe people to use their private health insurance. So there's now this whole raft of Australians that think, well, I might as well have private healthcare and not pay for the public system. But when they go into the healthcare system and they find out they've got to spend $3,000 of their own money on a reconstruction because the private healthcare industry doesn't even cover them because of the gap, they use the public healthcare system. So it double hammers the public healthcare system. It is literally just free money. Most people, if they've had private healthcare for 20 years, if they look back on what they've spent and what they've got back, would say that it was a joke. It's also very damaging because that money could be used for the public healthcare system. It shouldn't be distinct and segregated in our tax code that if you've got a private health cover, which is the enemy of the public system, you benefit from that. Why not have this money, however, it was $2 billion in 2003. Imagine what it is now. Imagine if all that money went into the public healthcare system and we didn't have this surcharge and you got that money back. And actually only people that really, really could afford private health cover got it and it wasn't subsidised. These free market economists at the Liberal Party and the Tory Party in the UK have never met a free market they fully support. They always need to go into bat for it with public subsidies. That's socialism, I'm afraid. So, private healthcare in this country has gone the way of the dodo, or it would have. It's been artificially kept alive by this tax rebate. There's no such thing as a free market economy judging private health cover because it would have died out. And it's a good thing that it does. As the people in Finland said about their education system being ranked number 1 in the world, if rich people have to send their kids to public schools, they make damn sure they're good. And it's the same with private health cover. So take this out. It is actually much better in this incredibly tight economy where people can't afford rent or mortgages, where they've got much less disposable income, to give people a few $1,000s back at tax time because they will spend a lot in the economy, generating a lot more revenue for our businesses. When we're so tight, we don't get anything back or we have to pay more. If I got a few grand back, I have got a list of things that I want to buy. So does everyone. So stop giving money to the private healthcare insurance when people don't really even use it when they go into hospital. Give us some tax back.